screening is a testing that I offer to all of my patients that assesses their risk of having a child with some sort of a genetic disorder, such as cystic fibrosis or spinal muscular atrophy. I feel that performing carrier screening on both partners is important because it's something that could potentially be a missed opportunity otherwise. I obviously am biased in what I see. I have patients who come to see me because they know that they're both carriers for a specific condition, or unfortunately they've had a child or lost a child because of a specific condition that could have been prevented had they both known in advance that they were carriers. So in my opinion, it's something that is definitely worthwhile and something that can be acted on, and that's why I recommend both partners have that testing done. The approach for carrier screening can really vary by provider. The American College of OBGYN recommends at minimum checking for cystic fibrosis and spinal muscular atrophy, and also screening high-risk populations for hemoglobinopathies such as sickle cell disease or thalassemia. They also recommend that patients of Ashkenazi Jewish ancestry or other high-risk ethnicities have additional testing performed. Another approach, which is typically what I use, is to do universal expanded carrier screening, where many different conditions are screened for based on just having everyone do the same thing, because there are so many people that have various ethnic backgrounds that they're not even aware of. The way that I counsel patients is that if one partner is positive for a condition and the other one is not, there's a very low likelihood of passing that on to a child. I do still recommend that they consult with a genetic counselor to discuss what's called a residual risk, meaning maybe something's not being picked up on the test, to know about those risks. If both partners happen to be carriers for the same condition, then there's actually a 25% chance that that could be passed on to a child. And in that circumstance, I again recommend the genetic counselor, and then their options would include doing IVF with PGTM, or pre-implantation genetic testing for monogenetic disorders, or doing testing during the pregnancy. Carrier screening cost really depends on the company that is being used by each clinic, and so that's something that can easily be discussed within the office.